Welcome to Delivering Miracles, a podcast to teach women like you tips and strategies on how you can have a safer pregnancy so you can bring home a healthy baby. I'm your host and your high-risk pregnancy expert, Parijat Deshpande. I can't wait to chat with you. When I landed on bed rest 6 weeks into my pregnancy, I had to stop working. And that not working phase lasted through pregnancy, through my son's lengthy NICU stay, and for years after he came home so I could keep up with his medical appointments. Not having a career or that extra income while still having a job that was flexible so I could care for him was so stressful. And I know so many moms feel the same way, which is why I recommend Christine McAllister's Income Replacement Formula book. And you can actually listen to it for free while you're shuttling yourself to doctor's appointments or keeping up with your kids' activities. Head over to audibletrial.com/deliveringmiracles and download this audiobook for free and get a free 30-day trial to check out Audible's service. That's audibletrial.com/deliveringmiracles. Hey, have you checked out my brand new book, Pregnancy Brain, yet? It's all about the mind-body approach to stress management during a high-risk pregnancy specifically. It has stories from my very high-risk pregnancy, tons of client stories, and so much research on the impact of stress on pregnancy and pregnancy complications and how you can have a healthy pregnancy. I would love for you to check it out at pregnancybrainbook.com. That's pregnancybrainbook.com. I love our pediatrician. I mean, I love her so much. I want to be her friend. I want to see her all the time. I love talking to her just about my son, but about life, about politics, about just anything really. I love her as a human being. And for people around this area, I very frequently refer them to her, especially if they're preemie parents, because she herself is a preemie parent. And she was referred to me by our NICU because she is so well versed in taking care of preemies. And having had a 24-weeker, I was really, really insistent on finding a doctor who was going to be able to see my son for who he is, not be blinded by the diagnoses that he was coming out of the hospital with, not by his gestational age, but really understand who he is and give him the best chance to grow and thrive. And we totally found that in her. And I think it makes all the difference. It makes all the difference because especially when you're a first-time parent, and for us, we were first-time parents who were parents to a micro-preemie on top of that, right? So we already didn't know what we were doing about parenting a human being, let alone taking care of a 24-weeker. Having that pediatrician who trusts you, who believes in you, who empowers you to make really good decisions, who empowers you to trust yourself when you're not sure what's going on, it is invaluable. It's invaluable. It completely changed the way that I experienced parenting from the NICU to outside in the real world, because she helped us grow our wings to be parents and to raise our son to be a happy, healthy boy, despite all the medical challenges that he came home with. And so when I met our guest today, and I met her virtually, I haven't yet met her in person. That is on my list of things to do soon. I got the same feeling because she's so much about empowering women and couples and parents on how to not get caught up in all the noise that's out there about what you should and shouldn't do for your children. I mean, if you spend 5 minutes on Google, you can find 15 articles on the one thing you should do to feed your child, and then 15 articles saying exactly the opposite. It's confusing and it's overwhelming. And so I'm really excited to have Dr. Jen Trachtenberg here today because she's amazing. She's all about empowerment. She's all about education, information, advocacy, and really helping parents around the world be the best parents that we can be for our specific children. And I love her message. So I'm really excited that she's here. Pediatrician Jen Trachtenberg, known to her patients as Dr. Jen, is a nationally renowned parenting expert, board-certified pediatrician, and has maintained a successful private pediatric practice in New York City for over 20 years. She's also an assistant clinical professor of pediatrics at the Icahn School of Medicine at Mount Sinai, a spokesperson for the American Academy of Pediatrics, and mother of 3 children. Dr. Jen has also appeared numerous times on NBC's Today Show, CNN, and Fox News, and she contributes regularly with health and parenting topics, including child development, newborn care, nutrition, childhood obesity, and sleep issues to Parent Magazine, First for Women Magazine, Baby Chat TV, Fatherly, The Bump, and RosiePope.com. Basically, she's amazing. She has also, if that's not enough, published 2 parenting books, The Smart Parent's Guide to Getting Your Kids Through Checkups, Illnesses, and Accidents, and Good Kids, Bad Habits, the real age guide to raising healthy children. And now her one-of-a-kind video parenting manual, Pediatrician, in your pocket. I'm so excited that you're here. Welcome, Dr. Jen.
Thank you for that great introduction. I really appreciate it.
I am really excited to talk to you. I've been thinking about this interview for so long since we connected a while back because your message really, really resonates with me in how empowering it is. I keep using that word, but that really encapsulates exactly, I think, what you do and what your mission is for parents and for children. So before we jump into all the amazing knowledge that you have, I'd love to know what made you decide to become a pediatrician?
So I always knew from a young age that I wanted to be a physician, but not necessarily a pediatrician. So I think I just went, my undergraduate training actually is in clinical nutrition. And so that was always really important to me. And obviously good nutrition development is important for children. And when I went through all my rotations, I really sort of clicked with pediatrics because it was that combination of caring for not just the child, but also the parent as well, and being able then to be sort of, as you said, an educator to help inform them, to educate them, to be the best parent that they can be, to offer help, guidance to that specific child, because each child has separate needs. I have 3 children of my own. One actually does have special needs. He wasn't a preemie, but has special needs. He has autism. And just the seeming how, though you have the knowledge, that sometimes you have to use it differently for each child. So it was really about, again, like as you said, empowering parents to use the information and to ask questions and to feel confident with their knowledge, but also feel confident in their doctor that they choose as well, too.
Absolutely. And I love what you said about how you have to use the same knowledge differently with each child. I think that is so, so true because you keep everything constant, right? The parents are the same, the house is the same, the family is the same, the culture is the same, but every single child is so different. And so it's almost a joke amongst my friends that, oh, if you have a second, it's guaranteed to be different than the first.
Right. And it's true. In their environment, the temperament may be different. So yes, to me, always, I have to say safety always comes first when it comes with children. But besides safety issues, sometimes parenting is different between siblings. It's not all the same. You can love your children differently, and that's okay. What I think is really important with parenting that parents need to know right from the start, though, is being persistent and being consistent. And those 2 things are really, really helpful, especially for kids, because then they'll know more what to expect. They understand demands. They know that you're there, that you'll always be there for them, that you love them, that they have, a home and they're going to have their needs met, but that, each child though is unique in their own way.
Yep, absolutely. And so much of that comes from parents, like you said, providing that consistency. And I love that you as a pediatrician are sending that message to parents too, because I think we live in an age right now where it is really confusing how to parent our children. People like me come from a family where our parents were immigrants. And so we can kind of look to them for ideas on how to parent, but the culture itself, the generation has changed. And even if there wasn't that cultural component, just how much access to information we have online, it's really confusing. What do we do? How do we do it? How are we not going to mess up our kids that badly? What do you do when you talk to parents who are coming in overwhelmed with just kind of information overload?
Right. So I always have parents, first of all, write down their questions if they have them. So then this way I can answer them. And I do tell them, like a double-edged sword, just like you're saying, the internet, there's so much, Dr. Google information out there. And the issue is that it is confusing because like you said, you get different information depending on who you hear it from. And not everyone really is an expert in their fields. They may just say that they are, but they may not have true credentials. And oftentimes parents don't really look at where studies may come from. they just like heard from a friend that something may, not be good for them. And then they get concerned too, but there really isn't any data to support that. So really one of the reasons why I did Pediatrician in Your Pocket, which is a comprehensive video guide for parents for caring for their newborn from newborns through toddlerhood, is to give them access to information that's evidence-based, the same information I use on my patients, the same information that I've used, for 21 years with my children. And again, it's all about, as I said, safety and nutrition and sleep and, different techniques and things that you can do. And it's just all there for parents right on your phone. So this way you have that information, really what's an emergency, common illnesses, and it's just everything right there. So I often tell my patients, sometimes it has the answers to your questions, but also questions that you may not have even thought of to ask. But without that, tone that's derogatory or telling you what to do, just kind of giving you that information so then you can make informed decisions for your child.
Yes, absolutely. And I think this is where our work really comes together, because that's exactly the philosophy I have too, is we can't make decisions confidently about our child if we don't come from an informed place. And informed doesn't necessarily mean more information. It means the right information for your particular situation.
Right, exactly.
You've mentioned a couple of times about safety, and I'm curious what you advise your patients and your parents on. What are some of the biggest safety issues that come up as you're seeing your patients in your office?
Well, there's so many different ones, but I guess because maybe you specifically talk about expectant parents and newborns and preemies. So obviously for me, one of the big things for safety is SIDS, sudden infant death syndrome, and having babies sleep on their back. And I know that's really, really important. We know that definitely decreases SIDS. Having baby close to mom in the same room is particularly important. Breastfeeding can also be very helpful in preventing SIDS as well too, but the importance of really having baby safe on a hard surface with not pillows or anything that can cause suffocation or strangulation is really, really important. And that's probably like the major message right from the beginning that would be with SIDS is, I think, really, really important.
What do you say to parents who kind of come back and say, well, so many cultures around the world co-sleep or they bed share and those babies are fine. Why can't I do that?
Right. So it's not that, first of all, again, it's a little bit like apples and oranges. So co-sleeping in our country here may be very different than co-sleeping on a hut or on a hard surface with a baby on the floor than in Tempur-Pedic, 12-inch mattress with 6 blankets and pillows and pads around you. So there's a very big difference between, so that's one thing. So really, I think that's really what, it's hard to make heads and tails of sometimes, but we do know that, again, being on your back for babies. So and then it's not to say that they, moms shouldn't breastfeed, but then to put them, that they are co-sleepers right next to them, that can be right next to the bed, to make it easy for mom to feed, because babies do feed frequently throughout the night, and they should, because their stomachs are small and they're still growing and they need the nutrition. You have to really take all those factors into consideration. There's also, again, partners that may be sleeping in the bed that may be unaware and roll over on the baby. And that's a big scenario that happens as well too. So it's always important for them to know, if the other person to know that their baby is feeding or if their baby is in the bed. And again, alcohol or any mind-altering drugs or anything like that can also play an issue with safety with SIDS or sleeping as well in beds too. So I think, I don't think anyone has their head in the sand. I don't pretend that co-sleeping doesn't occur, that sometimes it's just crazy. But I think that parents need to know all the issues, particularly the first 6 months when SIDS is the highest. Again, smoking is also another risk factor with SIDS as well too. So I think it's just a combination of everything. But again, the Back to Sleep campaign has really made a huge difference in decreasing SIDS and improving safety for babies within the first year of life.
Yeah, it really has. I really like that campaign when it came out. And you hear now also Baby in a Box, I think is what it's called. I'm probably butchering that name, but there's a huge movement now of sharing that box and having that available to parents before they leave the hospital. Like it started, I think in Sweden, was it, or something?
I think it did. And then it's a few
love that.
Now I posted that as well. And right, that's really all you need, right? You don't need, and I think though, those boxes though, like they do come with diapers and some other things as well too, but just a
Right.
safe place for baby to be. And also it's not just, really for sleeping. Safety is also, babies may be colicky or crying. And I think, parents and mom's health are really important too. Sometimes you can do everything, hold the baby, swaddle the baby. And again, in my pediatrician in their pocket, I took many, many methods of calming and soothing a baby. But sometimes, you need help from somebody else, whether a partner or a babysitter or a friend. But if not, and the baby is crying, the safest thing to do is to put the baby down in a safe place, whether it be a crib or, like you're saying, one of these special boxes, a playpen or something with a hard surface, and walk away if you need to. Take a deep breath. Better to put the baby down than obviously to get upset with the baby or shake the baby, so you have to take care of yourself so you can take care of the baby as well too.
Absolutely. And that actually leads me to a question I was hoping we would get to today is, while you're a pediatrician, so technically your patient is the baby, but you are also the person who sees mom most frequently postpartum.
Yes.
What do you recommend to moms to take care of themselves? And what red flags do you notice that makes you kind of escalate to mom and kind of start having that conversation about her mental health, her physical health, and her recovery postpartum?
Sure. Well, I'm pretty lucky in my practice, because it's a smaller practice here in New York City on the Upper East Side, that I have very close contact with my patients and see them frequently, and do ask at every appointment how they're feeling. And I can even sort of get that sense, I guess, being a pediatrician for over 20 years now. But, you can kind of see if they're feeling uncomfortable, if they don't really want to hold the baby, if they don't really want to feed the baby, if they're having more moments of feeling sad. I mean, it certainly can be overwhelming. And I think if you ask almost any mom, they're going to tell you that it's overwhelming, that, the 24/7, you don't really think about the sleep deprivation as much. I guess I did as a resident before I had my children. But in general, most people don't go through that. You
hear about it, but you don't know how bad it is until you go through it and go, oh my gosh, I'm really not sleeping.
Right. It's really hard to make decisions. It's hard to take care of the baby, to feed them, to bathe them, to nourish them when you're so sleep deprived. So I think it's important for parents to know that, and that it's okay to ask for help. And it's okay to ask for help, whether it be to help with the baby or to help with another sibling or to get help for themselves. So I do, again, I'm in New York City, so it is easier. I do refer this specifically to therapists, to postpartum therapists. There are sometimes psychiatrists, reproductive psychiatrists that also see some of my patients if need be. But it's something that we talk about at every visit, just making sure that mom is okay. Because when mom's okay, it's more likely that baby will be okay as well too. So it's really that dynamic that's really important.
Absolutely. And I think it's very easy to forget that connection. I know I've forgotten it many times myself, that I need to be healthy in order for my child to be healthy. And
Correct.
I have to be taking care of myself in order for me to take the best care of my child. It's really easy to forget that. It's
very easy to forget that. And I think I didn't really get that message again, 21 years ago when I had my first one. And, you sort of hear it, but there's so much guilt about not being with your baby 24/7. And I think that now the message is getting out there with pediatricians and pediatricians like me and the work that you do, how important it is for self-care, to take care of yourself, even a few minutes, here and there throughout the day, or even, to have a break, to feed yourself, to nourish yourself, and to slow down so you can get some sleep or some rest. It's not important that, especially those first few months of life, right, to have the cleanest house or to write thank you notes or to post so many pictures. It's that time for you to bond with your baby, but also some, downtime for yourself as well too. And as I said, it's okay to have partners and other people who may do things a little bit different than you do, and your baby will still be okay, but it will help you in the long run too.
Absolutely. I love that. As you have built your practice and worked with, I imagine, thousands of families, what comes to mind as maybe the top 2 or 3 misconceptions that most new parents have about parenting that you want to dispel for everybody?
So I think the first one is that, I see that, especially when they're little, that you never can say no, that you have to give into all the demands, that you're not a good parent if you don't give your child everything. And what they do need from you is their love and their support and their guidance. And so sometimes that is saying no, and that's okay. And again, it depends on the age of the child. So a young child, Again, when I say meaning no, so that's usually safety issues, right? So if they're going to touch something that's dangerous or they're going to run into the street, it's okay to say no and to move them away from a dangerous situation. It's okay to give them two options, both that are okay, but not always maybe the thing that they want at the time. So I think that's a misconception that parents may have.
I love that. And actually, before you go into number 2, I just want to reiterate that to our listeners, because I used to practice as a child therapist before I started this business for high-risk pregnancies. And I can't tell you enough how true Dr. Jen's point is right now, that it's not just that it's okay to say no, but you need to say no, because the way children develop, they're looking for those boundaries and they feel safe with boundaries. They are needing those boundaries to properly grow and develop emotionally, cognitively, socially, and all of that. And so this is a really, really important piece of it. It is a really great skill to learn how to say no, to know what your boundaries are, and to express that in a way that your child can understand based on where they are developmentally. So thank you for that.
Exactly. Yes. And saying no is not the same thing as hitting or anything like that. It's just meaning that they may have, also learning to sort of wait a minute or two. And again, it has to be, like you said, within the time frame of the child. So it may be 30 seconds or something like that. And I'm not talking about making them wait an hour if they're, only a toddler or something like that, but learning slowly and learning.
Right. Because that's like a lifetime for them.
Right, that's like totally like a lifetime. And just going back, even prior to toddlerhood, a big misconception, I think, is that you're going to spoil your baby. And this is the opposite, I think, of what we're saying early on. So that what I call that fourth trimester, that first 3 months and maybe longer, obviously, if you have a preemie, that babies need to bond and they like to be held, and it's okay to cuddle them, and you don't have to put them down. If they're okay and they're comfortable, you can put them down, but holding your baby and caring for your baby and picking them up when they're crying is totally okay and what you should do, particularly in those first few months in those newborn period. Babies have these reflexes that make them startle and they cry and they can't really soothe themselves. And it is okay to soothe your baby. You shouldn't let your newborn just cry because, that's again, like what grandma or someone said, that's what we used to do in the old days. Babies like to feel safe and secure. And I think that's really important.
Absolutely. And how long would you say that time period is? Because you're right. A lot of parents are very worried about spoiling the baby, and they kind of go, oh, well, you should be sleeping on your own, or you should be self-soothing by now. Right. But realistically, how much time would you say, hey, you know what? Give them what they need. You're not going to spoil them.
So for that not going to spoil them, I would definitely say the first 3 months. Basically, as I said, they have a lot of reflexes that wakes them up, that startles them, that start to really disappear, and that self-soothing mechanisms start to kick in around 3 months. Doesn't mean perfect, so that's why some babies start to sleep longer periods of time, and that's like a whole nother probably episode about getting your baby to sleep and how long they're sleeping. But if a baby even then is sleeping 4 to 6 hours, it really depends on the time, right? So if your baby is sleeping, say, 6 hours, and that's midnight to 6 in the morning, well, that parent's going to tell you, well, they sleep all night and they're really happy because they get a lot of sleep. But if your baby is sleeping 6 hours and that's, say, 10 till, 2 or 3 in the morning, then they're upset because their baby's not sleeping. But it's, again, it's really the same thing. It's just that it's at a little bit of a different time period. So they do start to self-soothe and they do start to sleep longer and able to maybe just play by themselves for a few minutes after 3 months or so. And that's okay then. If they're going to cry, you can let them sort of wiggle around a little bit and see if they start to soothe themselves and give them a little moment or two, not jump right on top.
I never really appreciated how much we have to teach our babies to sleep until I had my own child, and how much of that was just so instructional. This is how you go to bed drowsy. This is how you get yourself comfortable. This is how you fall asleep. It was really interesting to witness how much of that is really taught by our parents.
Again, and like you said, and again, to me, it comes down to routines and being. And I'm not a big scheduler, but routines are important. Boundaries are important for kids to know, and the consistency. And I think that's really where all this comes together.
Absolutely. I love that. So myth number 1 is kind of under this umbrella of have a routine, have boundaries, don't be afraid to say no to your child. What's another one that comes up for you with your patients frequently that you want to dispel?
I think another big issue, the first one we sort of talked about was sleep, but would be like nutrition and what to feed your baby, how to feed your baby. And I think we sort of make it much more complicated than it needs to be. The issue is that within the first year of life, you really want to try to introduce them to as many flavors and textures by the time they're 1 year of age, and really stay away from really processed foods, high sugar, high corn syrup, and high fructose corn syrup, and junk as much as possible, and give them as much fruits and vegetables and healthy grains and fish and meats and, all different foods. But I think it's about being persistent and consistent. And again, the same thing, just really introducing a wide variety. And it doesn't have to be really difficult. It doesn't have to be gourmet. But I think the wider the variety, the better it is for their palate. And that doesn't mean that some kids aren't going to be picky. But what I've seen throughout the years is that if you start this early on, as they do grow up and as they do grow older and they see that this is the foods that you eat in your family, they will then, when it's their time and they're ready, they will start to eat them as well, and not just go towards all the junk processed foods that are out there that are sort of simple and easy sometimes for parents just to grab.
That's fantastic. I can certainly relate to this too. I hear from a lot of friends of mine who have young children as well. It's scary and overwhelming. How do I feed them? What do I do? And it goes back to that information overload. Do I do purees? Do I do baby-led weaning? Do I do some kind of in-between thing? How do you teach your parents to follow your baby's cues? Because I think that's really what it comes down to, right? It's what does your baby need and how can you do that? How can you give them that?
So again, for feeding, definitely is following your baby's cues. So it's usually somewhere between 4 to 6 months. They do have to be ready. So be able to sit, hold their head up, sort of kind of grabbing toward, looking to want to eat, being able to swallow. I have always been, you can call it what you want, but I do like to start with purees just because, again, this way they will learn lots of different flavors right from the start. There is no special way. There's no evidence showing that you have to do vegetables before you do fruits. You can sort of mix it up. It's totally fine. You don't have to do one before the other. You don't have to do certain colors before other colors. And then usually around 6 months of age anyway, most babies can start to take very small pieces of foods themselves, more chunkier pieces. And then even by 8, 9 months, they have a pincer grasp and they can start picking up foods by themselves. And again, by a year, they're really, the whole objective is to get them on to 3 meals and 1 to 2 snacks a day, and hopefully drinking water as well. From my perspective, I start water with children at 6 months of age. Again, it just gets them used to it. Parents usually tell me they only take a sip or two when they're eating. And I said, that's fine, but you'll see by the time they're 1, they'll be used to it. And this is what they'll want instead of very sweet, juices and drinks and sodas. And all my patients, I have 20 years of practice under my belt, even more. And I could say pretty much all the kids in my practice, they are, healthfully wanting and drinking water as to quench their thirst because they've done it from such an early age on.
Yeah, I can really speak to that personally. Seeing my son just turn to water for his thirst. We don't do juices at home. And for his dietary restrictions, we don't have milk really for him either. But you're totally right. So much of this is really training. It's training the palate, training their bodies to know what to turn to when they're hungry, when they're thirsty. And if we offer them healthy choices, then that's what they're going to grow up believing is the source of nutrition or food or hydration or something like that.
Correct. And that's the real crux of a parent, is to offer the choices. It's not to force them to eat, not to eat a certain amount, but to have the choices available to them so they can see them. And then obviously it's great if you can be eating with them or around them at the same time so they see you modeling that behavior. So children really look up to their parents. Oftentimes parents don't believe that, but you are definitely their role model for a very, very long time. And you may not hear it till they're older, in their teens and even later, but you definitely are. And they do what they see you doing. So whether it be nutrition or whether it be what you're eating and exercising, socializing together, doing things together as a family, it's really important, that modeling of that behavior, because that becomes internalized for them as well too.
I love that you said that. You are so right. There's that old adage, right? Do as I say, don't do as I do, but that's not how children develop. They do what they see us doing, which can be, I recognize for those of you listening, it could be a little overwhelming.
Right.
Like, oh my God, I'm not perfect. I'm not doing anything right. I don't want my child to do this. That's okay. They're also very resilient, and they learn by watching over time. It's not that you do something, you have a bag of chips in front of them one day and all of a sudden they're going to be eating bags of chips for the rest of their life. It's not a one and done thing. But it's a really good opportunity to do some self-reflection and see, where can I improve the habits that I've wanted to improve? And now here's a really great reason to do it also, so I can pass it on to my child.
Yes, and that was my first book, Good Kids, Bad Habits, really about making small changes. And that's the whole idea, not overwhelming. You pick one small thing. And because it does take 90 days to really to make a major change become into a habit. And so whether it, as you said, be adding a fruit and taking away one bag of potato chips a day, that's a great thing to do, or a family walk with the dog, or just reading a book at night. So just pick one thing and then move on from there. And then these habits just continue, and they sort of just become almost like muscle memory. And then you add more and more. And it's not about being perfect. It's about being healthy and happy, and the bond that you have with your child, and having your child be the best person that they can be with the guidance that you give them and show them.
That is fantastic. I'm all about that. I love that you said that. I love that that's how you practice. It's amazing. As you know, because of the nature of the show, we talk a lot about infertility. We talk about high-risk pregnancy. And so a lot of our listeners are either at risk for delivering preterm or are parents of preemies. What one or two pieces of advice do you have for preemie parents on how to navigate parenthood, whether it's their first child or their fifth, but having a preemie can be so scary. So what are a couple pieces of advice you can give to our listeners who are preemie parents?
So I think it's important, as you know, and as you pointed out, so preemies are certainly, because they're born earlier, are at higher risk for developmental delays or issues. And again, doesn't necessarily mean that's going to be the case, or physical issues. So I think it's important. Preventative care is really important. So make sure that when you can, that you go to all your pediatrician visits, that if they advise early intervention or just other screenings, to make sure that everything is done in a timely manner. We know that early intervention, whether it be physical therapy, speech therapy, occupational therapy, whatever it may be, the earlier you start, the better it is, the better outcomes that we see. So there doesn't need to be a label, but just really working and getting what you need for your child is really, I think, what's most important at a young age.
Absolutely. And again, I can really personally vouch for this. Because my son was so early, he was in all kinds of therapies. He actually did extremely well for a 24-weeker, but our pediatrician had the same philosophy of, hey, let's just get him that extra support early so he's not going to need as much of it as he gets older. And here's the thing, what I hear from a lot of my friends and acquaintances as well, there's a fear about something like physical therapy, or, oh my gosh, my child is going to be labeled, or, oh, I feel so bad for my child, or something like that. You don't want to go there because it can be scary. You don't want to have to do that. And I'll tell you personally, just having seen physical therapy as a parent for a child, it's nothing but play. They don't know the difference. They don't know what's happening other than, hey, here's just somebody new to play with some new toys. And in the process, we are working on all the skills that they need to learn to develop properly going forward. So I know it can sound and feel scary, but as a parent, I can reassure you that it's anything but that, and they're going to have a blast when they go. Yes,
and the same thing with occupational therapies, and that's just the fine motor skills. And the same thing with speech. Again, I did a whole segment on speech and how it's really all through play. And that's how kids learn, through play. And I think it's important for them to play physically, and again, it goes back to not too much screen time, because we want kids to be out and about and, using their hands and their feet and reaching in the environment and cause and effect and trying different things and seeing the emotions on people's faces and that joint attention. So all these things are so important, guidance and one-on-one with children. So yes, these therapies are usually really fun, and kids, for the most part, really, really do like them and enjoy them. It's just like having another play date.
Yeah, exactly. where the person actually does more of what you want anyway. It's not, there's a little less negotiation there. So it actually is really fun. My son is actually still in occupational therapy, and he has so much fun there. His therapist is his buddy, and they've created a little magical world in their session. I mean, it's just really nice. And in the process, he's learning so many skills, and he's actually developed so well over the last year. So it's really, really worth it. If you're listening to this and you've been on the fence about taking your child, it's absolutely worth it. And you will see a change because you're getting that extra support for your little one. I guess the last question that I have for you here is, you mentioned Pediatrician in your pocket. I love that you have that. Can you tell us a little bit about what inspired you to create it and what it's all about for our listeners who don't know?
I would love to. So Pediatrician in Your Pocket is a full comprehensive video guide, and it really is one of a kind. So you can do Dr. Google, and I'm sure you can find something on how to get my baby to sleep when they're, 3 months old, or what first food should I give my baby, or what are common respiratory illnesses. But I've basically outlined, it's like an encyclopedia of how to care for your baby from newborn through age 2, with parenting tips as well. But it's all me on video, speaking directly to you in a way that's easy to understand. And then you just have all that information. So you can go to my website, drjen.com. You can purchase it there, and then you can download the whole entire series. You can watch any episodes that you want. The episodes are anywhere between 5 to 20 minutes. There's a whole developmental section, just so you know, also going through each month what to expect, what your baby should be doing, within what range, what toys and activities would be helpful as well, and then red flags as well to look out for that, you may be seeing at home that you may want to bring up to your pediatrician as well, or for early intervention as well too. Just as I said, because I think getting them proper therapies early on can be so important for improving their long-term outcomes. So there's a whole section on that as well too. And I think it's just in a way that parents know that, again, they're getting me, Dr. Jen, a board certified pediatrician, really giving the evidence-based information that's out there so you can then make the decisions that you want. And you just have it, and that's just, what parents like now. I think it's really hard to read a book, again, when you're really exhausted, or to find someone that you know and that you can trust. So I spent the time, and it was very labor intensive, doing this whole entire series. It's probably somewhere 10, 12 hours, broken down into small subcategories and into small videos that parents can watch as needed, but the whole series is there. So I just was really a labor of love. I get to do it with my patients, but I wanted to do it on a wider range, as I said, throughout the country, even throughout the world, so parents can have this information right at their fingertips.
That it's fantastic. And from what I've seen for it, I haven't actually looked inside the program, but from what I've seen on the outside, it looks incredible. And it really addresses the concern you started this episode with, which is to look at the source of where the information's coming from, and knowing that it's coming from a board-certified pediatrician, somebody who's been an expert in the field for multiple decades. It really does give a sense of reassurance for parents who are awake in the middle of the night going, what was that? And what do I do? You've got the answers right there. So we're going to link all of that in the show notes below for those of you that are listening if you want to learn more about Pediatrician in Your Pocket. Dr. Jen, thank you for being here. One final question that I ask all of my guests, which is, what are your final words of hope for couples or women that are listening right now who are getting to the end of their pregnancy and ready to bring their baby into the world?
So my hope is, I think we spoke a little bit about it, is that moms and dads too, but moms take care of themselves, knowing that it's just important, if they care for themselves, they're going to be able to so much better care for their children as well too, to make them healthy and happy, and really, grow up and let them be who they are, but be prepared and be supportive of your child as a whole.
That's just beautiful. I love it. And tell us again, where can people find you if they want to know more about your work or Pediatrician in Your Pocket?
Sure. So the easiest way is drjen.com. So it's dr-jen.com. And I'm also at Facebook on Dr. Jen Trachtenberg. And on Facebook every Wednesday, except today because I'm doing your show for you, I do a What's Up Wednesday with a topic of the week, something that's usually in the news or something of the month that the parents have been asking me a lot about, and really get to talk more in depth for about half an hour on topics, and people can listen. They can ask me questions there as well too. And then I keep it up on Facebook, so you can have that information there, and that's all for free as well too. So just so people, I can find out more what people are looking for, what they need more information about. And I'm hoping to give parents the information they need so they can make that informed decisions for themselves.
Fantastic. And again, we're going to have all those links up in the show notes, so it's easy for all of you to access and just one click away to go get a little bit more information. Thank you so much, Dr. Jen. I have so many questions that I know we didn't get to today. We'll just have to have you back on to cover some more topics, but thank you for the work that you do and for how empowering you are for new parents like me who don't quite know what we're doing, but you really do show us that we can trust ourselves to raise the best version of our children as possible. So thank you so much.
Oh, you are so welcome. Thank you for having me today, and I will definitely come back.
Fantastic. Oh my goodness, this was wonderful. If you haven't checked out Dr. Jen's work, you have to check it out. She is phenomenal. And I really do. I keep saying the word empowering, but that really is exactly what she's all about. That we can raise happy, healthy children if we are empowered to trust ourselves and to pay attention to our children's cues and give our children what we need. It is absolutely possible. And it's even possible if you have a preemie, if you have a micro preemie, if you've got a child with extra needs, any kind of medical complications, you can do this. You can do this. And that is everything that Dr. Jen is about. You know, I love that. And I really do believe in you. She believes in you. And I really want you to go check her out because her work is incredible. And I know you're going to be so inspired and really feel much more prepared for this role of parenthood that we are signing up ourselves for, to be able to raise the best version of your child, because you absolutely can do it no matter the circumstances. I really, really do believe it. Thank you so much for joining me here today. If you loved today's episode, please head over to Apple Podcasts and leave a review so more women who are going through a high-risk pregnancy or are preparing for a baby or are postpartum can tune into Delivering Miracles and receive the advice and tips from experts like Dr. Jen on how to be healthy, how to be happy, and how to raise happy, healthy children. And if you haven't yet, check out my brand new book, Pregnancy Brain, that has just come out, all about the mind-body approach to stress management during a high-risk pregnancy, so you can have a healthy pregnancy even if you have complications. You can do that at parijatdeshpande.com. Also, I would love to stay in touch, so follow me on Twitter, Pinterest, Instagram, and Facebook at Parijat Desh. That's PARIJATDESH. Parenting is the hardest job on the planet, and it can be really overwhelming if you enter that world having experience in fertility, a high-risk pregnancy, a preterm delivery. It's hard, but it's not impossible because you have the tools in you to raise a happy, healthy child. Be sure that you surround yourself with a team of people who trust you too. Take it one day, one step at a time. You can do this.